Hello, welcome to another show of Transformational Journeys of Hope. I'm Dr. Nadia at your service, and we're going to be talking about something fascinating, very dear to my heart, which is issues in the tissues for skin of color patients. This is a very daunting and challenging arena. Most physicians don't want to deal with skin of color patients because they're much more challenging to treat. There's much higher risk when you're dealing with lasers, and but the rewards of that are amazing. I myself am a skin of color patient. I had the same issues that Zaira has, even though she's much darker. I hyperpigment easily. I had a lot of other dark circles, for example, issues with ingrown hairs. So we're going to talk about acne as well and easy scarring. So Zaira is going to actually go ahead and share a little bit of her journey and how she started with Hope.
Yeah, and I started with Hope actually a couple of years ago. My dermatologist actually recommended me to Dr. Nadia. So when I started coming here, first of all, I love the atmosphere, love the spirit of the place. Now, when I started going here, I began to get microdermabrasions and things of that sort. So we were trying to bring my skin back to life. Now, throughout that process, of course, you have to pace it. Of course, Dr. Nadia, because if you rush into it, it could easily cause problems for the skin, especially skin of color, because we don't heal as fast. So throughout the process, when we were actually taking care of my skin, I actually stopped going to the practice for a little bit, and over the time, I wasn't following my regimen as I should have. So when I came back, Dr. Nadia had her work cut in for me. She had her work cut in for me to restart the process over again. But when we began the new process, which actually took place, I believe actually more towards the beginning of this year, I've seen tremendous results with my skin. And working on a plan with Dr. Nadia, it's eased me into the process. It's definitely eased me into the process.
So basically what Zaira came in with was multiple issues that are common for skin of color patients. One is oily skin, hyperpigmentation, acne, which left a lot of dark marks and hyperpigmentation. She had ingrown hairs as well that were causing scarring and hyperpigmentation. So a multitude of different issues. So we started with a customized program for her, integrating. This is an integrated practice. So what we did was take her off any kind of medications, any kind of topicals that were harming her skin, that were over drying her skin. I find a lot of patients that come in, they tend to over scrub and over dry their skin, and as a result actually stimulate the acne more, not knowing. So first was to train her on how to properly balance her skin out with natural lightness and brightness, medical grade, but things that kept her in balance.
Exactly.
Address the acne, such as salicylic based products, getting away from things like benzoyl peroxide, which are very harmful. Not using harsh scrubs, but gentle exfoliation. So then we did microdermabrasions and peels initially to prep the skin. And then we went on to lasers.
Mm-hmm.
All right, so again, a layered process, individualized to her specific needs in a way that honors her skin and respects it, and is gently getting a gentler process, but yet getting really efficient results within a couple of treatments.
And one thing I want to add with that, exfoliation, it's good, but a light exfoliation. Too rough, and your skin is just...
What it does is actually when you over dry your skin, you're actually stimulating more clogging and more acne.
Okay.
So you have to have a balanced system, and people don't know how to balance their skin.
Exactly.
They tend to think they have to dry it out, whether it's through alcohol-based products or harsh scrubbing, and it actually exacerbates the acne. It does the contrary to what we're trying to do. And you certainly want to stay out of the sun, because pigmentation, hyperpigmentation in skin of color holds out for 6 to 9 months. And so we have a process of preventing the acne and accelerated healing so that you don't have blemishes. So one of the other things that we did with Zaira was laser treatments with a special laser for skin of color. Maybe you can start to talk about your experience with the lasers.
Absolutely. So we started off with the YAG, and pretty much it's a laser specialized for like darker skin. Any other laser, I'm not too sure. The other lasers that you actually have, they're not too for skin of color?
I have a couple of different. That's a nice thing about coming to my practice. I do have multiple lasers that I can utilize for skin of color patients safely, whether it's for stretch marks, whether it's for loosey-goosey skin, whether it's for dark circles, whether it's for hyperpigmentation and acne. I really have an armamentarium of lasers. No matter what your skin color and skin type, I can address it in the most efficient way possible and safe way possible too.
And the lasers were an interesting process. It definitely was. When you first go into it, you're like, you don't know what to expect. You don't know how it's going to feel. And once you put those balls in my hand, those stress balls, I'm like, what's going to happen? But you know what? It's actually not bad. It feels like it kind of feels like if somebody ever continuously sprinkled like your face with water, but it's almost like a little bit of a shock because it's a different feeling to get used to, but it's not unbearable. It's not unbearable at all. And once you start to get the hang of it, you get used to it. You get used to it. But it definitely, after getting it done, I saw my skin all in all. I saw my pores, getting tighter. I saw my complexion evening out. I saw people tell me all the time like I look younger. I'm like, I'm only 21, but I definitely see my skin take the next step and go to the next level, especially with the lasers added on with our process that we're already doing.
Our goals in our practice are interesting even for skin of color patients, and it doesn't matter at any age. It's amazing. You're young and you wouldn't think that you have a need for something anti-aging or regenerative. No matter what your skin type, we've all had insults, and we can take the skin and get it even healthier, more luminous, more even tone. We can stimulate stem cells through this process. So the laser not only addressed the ingrown hairs for her, but as she said, reduce the pores, reduce the oiliness, improve the turnover of the skin. So her skin is now responding better, healing better. If she has a blemish or if she has an acne, it actually heals much faster than it did previously. So her skin actually is genetically altered into a healthier state, that whatever minor breakouts that she might have at this point, it heals very quickly. We literally change the genetics of your skin, which is remarkable. So at any age, you're going to see something you've not had in a long time. And a lot of this is also about the educational and then the commitment. As she said, when she stopped going and she, did not follow a process, then, she took a step back. So then the maintenance is also important. You don't need lasers, for a while, but then, some sort of light therapy and light peels and stuff will keep her skin, and that's less of an investment than coming in for lasers. Exactly. We're going to come back after the break, and I will talk a little bit more about skin of color.
Wait, don't let this happen to you. At Jan Fence, we're family owned and operated for over 50 years, providing a wide choice of fencing. Why wait online at the big box store? Just call Jan Fence. Ask about our Easy Fence to Go products by Active Yards, the first truly do-it-yourself fence product.
At Jan Fence, we always do what we say. Come see us today.
Step into an extraordinary world that will excite your senses. Experience our delectable Mughlai cuisine and the magic of tandoori savoir-faire. Let our international award-winning team delight you with a taste of heaven. Enjoy our mouth-watering flavors and our unique flair for excellence. Savor the elegance of fine dining and catering. Shazam Restaurant. Indulge your taste buds.
Hi, I'm Dr. Sidney Cohen. I'm a psychologist in New Jersey. I'm the host of a show called Heading in the Right Direction, which will be appearing on internet TV station Radio Vision Network. It's a show that's going to cover a wide range of psychological subjects. I think you'll be very interested in the subjects. I'm also going to have the opportunity to send me emails, ask me some questions. I'll answer questions, and I very much look forward to you tuning in. I'm very excited to do this. Thank you.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
We're back, and we're talking about skin of color and our unique style at Hope Integrative Health. to help you be more balanced, healthful, more beautiful, more radiant, and truly a long-term solution to any issue in the tissue that you have going on in an easy peasy lemon squeezy way. Fun and healthful is zesty, I call that. It doesn't have to be harsh, and I believe in new paradigms of health, and that's what we bring to the table. So I want to show a picture of one of our patients here that had laser hair removal just like Zahara did. And if you take a look at her skin before and after, we had used again the YAG laser for her, and that laser is great for addressing ingrown hairs, dark hairs for skin of color, whether it be African American skin, whether it's Indian skin, anyone that pigments easily. You want a specific laser that targets that efficiently and does so safely. One of the risks that can happen is that you can get burnt easily, and I've seen a lot of practices treat skin of color patients and they really don't know how to do that safely, and if there is a complication, how to address that, because that's much more challenging than your average, fair skin patients that you're dealing with. And as you can see before and after, remarkable difference in the amount of hair, the pigmentation has gone away, the skin is much brighter and healthier, and typically you're looking at anywhere from 6 to 10 treatments depending on the density of the follicles and the hair. You have to stay out of the sun during this treatment, and typically we also have you be on brightening lightening products to further enhance the benefits of these treatments. All right, so let me show you also the next picture of someone rather unusual with the body hair. So here was a patient who not only had vast amount of hair on her face, but actually had her whole front of her body was covered with curly hair, and that was so embarrassing for her. I mean, here's a teenager who has like full body hair. She had a condition called hirsutism, and no other really androgenic problems, but this is what she had. So we ended up in this case, because of the amount of hair in his body hair, she needed about 10 to 12 treatments to eradicate most of the hair, and those are one of the toughest cases that I had to deal with, which is interesting that there is hope for what was deemed hopeless. No other practice would have really taken something like that on. So we do deal with a lot of challenging cases, and that's what I love about eye practice, that we bring hope into situations that are deemed hopeless.
Yeah. Absolutely.
Right?
Yeah, because I've seen, some of the pictures, especially even when you go to the website, you see the pictures, you see the changes. Even I recall a picture of a woman who had, what is it called?
Cystic inflammatory acne.
Cystic acne. And I know when I get those occasional, just one of those real big bumps, and it just hurts to touch it, and it's like, no, so you never know. With people like that and certain skin disorders, you always want a solution, but you always want the safest way possible.
Absolutely. And that actually highlights a point, because we're working with lasers and we're working with these kinds of procedures. What typically, what we've created in our practice is really making sure honoring the body. So every single procedure that we do, everything that we do not harm the body in any way. So we're not using any kind of harsh medications. We do not use Accutane in our practice. We do not use antibiotics in our practice. It's not necessary. So we can really laser focus in on the problem at hand, exactly, provide a solution, and the body is not harmed in any way, shape, or possible. Exactly. This is impossible for that, because the lasers work where they work, the treatments work where they work, and they're all safe, healthy, and good for you.
Exactly. When you're following along with a process like this, you always want to take care of your health. Not only that, but once you start getting this stuff done, you don't want your inside to be toxic, and then it starts coming out through your skin, and you're spending, you're spending money and putting effort into actually taking care of the topical layer, but you're not even invested on the inside. That's important. And
that's important. So one of the things I know I've talked to Zahara about is her nutrition, because we know nutrition plays a huge role. Having a very clean, non-GMO, high vibration foods. So you are, because a lot of this, the skin actually is one of the ways in which we actually excrete, toxins from our bodies. So if you're putting junk into our bodies, then it will show up with acne, with, with aging, with all kinds of things. Our body are complex systems with millions of processes going on every day. And we're, we as a society are not nurturing and nourishing our bodies in the best way possible, whether it's through sleep, whether it's through breath work, whether it's through nutrition. All of these processes are important. That's why the integrated process. We have you take self-responsibility.
Exactly.
If you're not taking care of your body and eating junk, it doesn't matter what I do on my end and how committed I am to getting you healthy. You have to take the responsibility. And I hopefully am showing you the way, because the way I am, I'm doing all those processes here so that I'm getting younger and healthy and brighter every day. I take full responsibility for my health, and I don't expect the physician to do the work for me and not do my part of it. Otherwise, it's really not going to give you a long-term solution. There's no just one medication or procedure that's just going to be, a long-term cure unless you are part of the process here. Okay, so we'll come back then after this commercial break.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at PurinaBeyond.com.
Fitzpatrick's. Deli dine for breakfast and lunch. And at night, gourmet dine for dinner with entrees and specialty sandwiches including certified black Angus cuts of beef and wild-caught seafood, plus catering options for specialty events. Since 1989, Fitzpatrick's, your hometown place with upscale tastes.
Apple Ridge is about freedom. Apple Ridge is about community. Apple Ridge is about home. Apple Ridge, everything you want, more than you expect. Welcome to your new neighborhood. Apple Ridge Senior Living. Enjoy a maintenance-free, affordable luxury lifestyle today. Visit appleridgeseniorliving.com and find out more about the Apple Ridge experience.
Welcome back. I'm Dr. Nadia, Hope Integrative Health, and we have Zaira Baker here, one of our patients, joining us, sharing her transformational journey at Hope. I want to talk a little bit more about acne for skin or color. This is a very challenging process. By the time a lot of our patients come in, they have really inflammatory lesions with a lot of hyperpigmentation. I'm very frustrated with the ingredients and the advice they've been given up to date. So can you bring up that picture on the acne for this gentleman? So here's a gentleman who had cystic inflammatory acne. He happened to be a landscaper, so he was out in the sun a lot and was sweating, and you can see huge inflammatory cysts, and was very, very frustrated with his skin. It was very painful, it was very disfiguring, and he had tried pretty much everything and nothing had worked. So we actually created a program for him that with a process called photodynamic therapy, which is special medicine that goes deep into the skin and tissue and actually targets the glands at a root level, because the glands are overproducing, they're hyperactive, they're highly sebaceous. And so what we did with that was with the medicine that goes in, we then leave it on for about an hour and a half. It's very safe. And then we activate it. We actually, it's a photosensitizer with an anti-inflammatory laser, a vascular laser such as a V-beam, a pulse dye, or Palomar G laser. And then once we do that, what happens is it actually shrinks the glands down. It partially, stuns them, and then when they grow back, they actually come back normal, less oily, less plugging. In addition, there's a higher skin turnover. We're actually stimulating the skin now to behave differently so that it's no longer clogging. You're no longer getting the plugs that you have. And so the P. acnes bacteria doesn't have a medium of oil and glands and, oil and, skin debris on which to feed off of. So, it's amazing when within that process, and it took about a couple of months with this gentleman, not only did we do the photodynamic therapy for him to address the acne per se, to eradicate that, but then as a result of subsequent lasers that we did, we also regenerated his skin so that his scars were minimized and he had smoother skin. And so we were stimulating new cells, fibroblasts, for that to happen. New collagen was built. There was a cleaner palate with that. And also reducing inflammation, which is the root cause of everything. So he no longer had an inflammatory process going on. His skin was robust and resilient. So when he went out now as a landscaper, he was not as prone to injury from the sun. And then we taught him how to protect his skin from the sun so that he would maintain the health of his skin. So these are true what we call long-term cures, and that's the beauty of this process.
Exactly. And what tips did you have for him on how to, after he had everything done, everything taken care of, how did you teach him how to treat his skin afterwards? What was the post-care?
Well, the nice thing about it is once you have healthier skin and, it's no longer sensitive and inflammatory, then the maintenance is easy. Mm-hmm. So what I did after him was make sure he had really good sunblock. We had him on things like vitamin C and green tea. Internally, astaxanthin, which is a powerful antioxidant, so it prevents sunburns from happening. It's actually 500 times more powerful than vitamin C. And so it's great. Internal processes, external, much easier. And then to come in once a month and do a microdermabrasion or a peel if necessary. Depends on the individual, what their maintenance is. And it depends how much you care for yourself. But it's much, much easier to do the maintenance than wait for things to slide before you come and see me. So the sooner you come see me, the sooner we can take care of things, and then it's so much easier. You wake up in the morning, there's really not much to do, but you do have to use your sunblock, and you want really good products like Elta MD, for example. Really nice products that provide a wide array of zinc physical blocks, which don't clog up your skin for both the face and the body.
And how important is moisturizing? Because I know moisturizing, even I was told with oily skin, you don't want to just try to dry out your skin like you said. You want to moisturize in some way.
Remember we talked about balancing the skin. So people are afraid of using moisturizers when they have oilier skins, and they're afraid of it clogging it up. We have this one product in our practice, which is like a drink of water and has a high concentration of hyaluronic acid, which is very hydrating and balancing, and it doesn't clog in anyway, and then it has aloe based and a little bit of vitamin C and E in it, and so it's a wonderful product that everybody loves. It's even great after, say, if you were to get a sunburn or anything, it will soothe and calm the skin. It's great for after insect bites and things. Some multi,
exactly. Give more bang for your buck.
Yeah, there's many ways in which it can be used, so it's multifaceted in that approach. So let's bring up the last picture here, and this is interesting because this actually picture happens to be me. All right, I would never have had my picture taken. Many years ago, I actually suffered from cystic inflammatory acne that was worse than any of my patients, and I had horrible, that was during my residency days when I wasn't sleeping, working 120 hours a week. The stress level was beyond. I had no time to breathe, let alone eat or do anything else, and I was taking care of very sick patients in the tertiary care. So it all came out in my skin, all the stress of that. This is many years later. I'd been on Accutane, all these harsh products, and still has some sequelae and damage as a result of it. In fact, one of the side effects of the Accutane treatment that I had actually left me with a condition called rosacea. Because they had stunned my glands, now I had sensitive, red skin, and it burnt easily as well, which I didn't used to have that problem. So so if you take a look at my skin is red, it's irritated, it actually would scar very easily and blemish very easily, and it would be many months before things would clear up. So I was constantly frustrated with my skin. I did the same treatment that I did for the previous patient with photodynamic therapy, and now you can see my skin after the procedure, and it's no longer red, has nice clean palette, has a fresh glowy feel to it. It is no longer has a scarring, no longer has even the dark circles went away from me. So much easier for me to maintain my skin. It's truly healthy, and that was probably 7 years ago, that picture of me before and after, and you can see I actually haven't done photodynamics since then, and my skin is still healthy, and I don't need that level of procedure, but once in a while I do some laser treatments to reduce inflammation, use things like Smooth Beam to help any kind of minor comedones that might still come out for me. So you know what, people will look at my skin and they think I don't understand what anybody else is going through, and that's not true. I have been through the worst cases of acne myself, and realize the psychological impact of having a face that you can't really put in front, especially with my job as a physician, as a healer. To have cystic inflammatory acne was really people judge you by the way you look, and they think you can catch something because it looks like an infection in that way. People don't know any better, and they are afraid of it. So it really made it uncomfortable for patients for FaceTime, and I was constantly covering it up. But thankfully, with the advent of lasers and all our treatments that we've offered now, we don't have to go through Accutane, we don't have to go through antibiotics, we don't have to suffer unnecessary, we don't have to have scarring. And so very blessed to be able to offer these kinds of treatments. Love the innovations, love the science, love everything that we have in our practice. So come check it out for yourself.
Imagine the finest hand-selected USDA prime steak you'll ever have. The freshest line-caught seafood, our Wine Spectator award-winning wine list, and soul-satisfying desserts. Bring that together with the perfect date, the winning business deal, a memorable family celebration. Welcome to Rod's Steak and Seafood Grill in nearby Morristown, New Jersey. Bring your appetite and feed your passion.
Your credit score is yours, and at Experian Credit Expert, we want to help you really use it. With access to helpful Experian experts over the phone and online, we can help you use it to get a better idea of what info the banks have on you. Use it to get more choice of mortgages. Use it to make your money go further. Take the next step to improving your financial future with your free 30-day trial at Experian.co.uk.
Here at Freppi's Tex-Mex, you can definitely taste the freshness in our food. You should definitely come to Freppi's because it's a great place. You can bring your family, very kid-friendly. All my servers are amazing, friendly people. Everyone here is just happy to serve, and I think it shows. The thing that sets us apart is the quality and freshness of our food. And I think once you try it, you'd be coming back. I'm Joe DeSario, co-owner of Freppi's Tex-Mex in Plainfield, New Jersey.
So we've been talking about Skin of Color, and it's been a fascinating show. And Zara has shared her journey with us, and hopefully it's going to be something that will support skin of color patients. We know we have so much to offer here through our new science, innovations, safe, effective procedures for all skin types. And so we're excited to offer these new technologies to our patients and to everybody that is ready for something truly healthy and long term. So welcome to the world of hope, and thank you, Zara, so much for sharing your journey. It's been great having you on our show.
Thank you so much, Dr. Nadia, for having me. And like I said, it's no better person to share this experience with than the person who actually took me through this journey. So thank you so much for bringing me to your show and sharing my story.
And it's great because, Zara, for example, they're like family to me. I have so many, we just have such great long-term relationships. So it's been a pleasure, and we shall see you hopefully soon at Hope as well. Dr. Nadia, at your service.